Thank you and good afternoon, everyone. Today we have 5 new cases, bringing our total active cases to 81. This is a decrease from 102 at this time last week. We continue our downward trend, and I want to express my appreciation for all of you who have kept fighting the good fight. You are making a difference. More than 82% of our cases involve a variant of concern. According to our data from May 13th to 19th, our weekly incident rate dropped to 35.5 cases per 100,000 population. This was the second lowest incident rate among nearby health unit regions. However, about 20% of our cases from that same period had an unknown exposure, meaning we still have community spread on our hands. We have one remaining institutional outbreak at Tillsonburg District Memorial Hospital. CEO Sandy Jansen is here with us today to provide an update on how things are unfolding at the hospital. 5 residents of the Southwestern Public Health Region are hospitalized, including 2 who are in the intensive care unit. On the prevention front, as of yesterday, 95,571 residents of the Southwestern Public Health Region have now received at least 1 dose of the vaccine. This is approximately 45% of the total population. With respect to vaccine, overall, the situation locally and across the province is improving. Half of the adults in Ontario have had at least 1 dose of vaccine, but that leaves half unprotected, and many with only partial protection from a single dose. So I'm reminding you, please keep following public health measures. Enjoy the recent opportunities to socialize in small groups and to participate in your favorite outdoor recreation. But do keep your distance and keep your visits outdoors. Wear a face covering if you can't maintain 6 feet of distance between yourself and others. We continue to offer 3 large vaccination clinics in Tillsonburg, Woodstock, and St. Thomas, and to boost the number of appointments available at each clinic as our vaccination supply continues to increase. Together, these clinics can dispense approximately 2,000 doses of vaccine per day. In addition, we have more than 30 local pharmacies and several primary care clinics and community health centers planning to offer either the Moderna or the Pfizer mRNA vaccine to their patients. These partners add additional capacity to our region of another 2,000 doses per week. Yesterday, West Elgin Community Health Centre offered a successful community clinic in Dutton, vaccinating over 400 people. Tomorrow, the East Elgin Family Health Team is hosting a pop-up clinic at the Fire Hall in Port Burwell. And on June 1st, there will be a pop-up clinic at the hockey arena in West Lorne. The most significant update in the local vaccination strategy was announced on Friday of last week. As of the weekend, youth between the ages of 12 and 17 became eligible for the Pfizer vaccine. We welcome all area youth who are 17 on the date of their appointment to our clinics. Public health has a long history of immunizing youth through its school programs, and our staff are well versed at answering the questions of our young people. Parents, if your child is a bit nervous about getting a vaccination, you are welcome to attend with them. Some tips we have for youth, or really anyone, arriving at our clinics during this warm weather is to wear cool, loose clothing, have a good meal, and lots of water before you arrive. That concludes my remarks, and I will now hand this media conference over to Sandy Jansen, CEO of the Tillsonburg Memorial Hospital.
Thank you, Dr. Locke, and it's wonderful to hear the positive news. So I would like to provide just a brief update of the outbreak at Tillsonburg District Memorial Hospital. So as has been reported, on May the 5th, we declared an outbreak at the hospital, and that was when 3 patients tested positive for COVID-19. At the hospital, we immediately instituted the highest precautions that we can for all of our patients and our staff, and we tested our staff and our patients. Unfortunately, by May the 7th, we had a total of 10 patients testing positive on 2 units and 4 staff members. And working collaboratively with Southwest Public Health, we made the decision at that time to close our inpatient units to admission. So we closed 1 south, 2 south, and 2 north to admission. We were able to keep our ICU and our emergency department open, and we also were able to continue our ambulatory care visits and urgent and emergent surgeries. Throughout the last couple of weeks, we have continued our ongoing testing of patients and staff. Our most recent testing on May the 20th revealed no further positive cases. So as of today, we have a total of 15 patients who have tested positive. 1 patient remains positive in hospital related to the outbreak, and 5 patients are in hospital and recovered. We have 6 patients discharged into the community, and very, very sadly and regretfully, we have to report 3 deaths associated with this outbreak. Our next swabbing will be tomorrow, and if it's all clear, then working again with public health, we hope to declare our outbreak over by May the 29th. I want to just take a minute at this time to express my sincere gratitude to Dr. Locke, Elaine Reddick, and Kitty Chan at the Southwest Public Health Unit. They have been just invaluable as it relates to guiding us and supporting us through this outbreak. I also want to thank the staff, the physicians, and the leadership team at Tillsonburg Hospital who have been tireless in managing this outbreak. I also want to thank Woodstock Hospital and Alexandra Hospital, who were able to accept admissions that would have normally come into Tillsonburg, but we moved them to Woodstock Hospital and Alexandra Hospital. And lastly, of course, all of our community partners and our community members for your just tireless and unending support of the team here at the hospital. So thank you very much, and I'll pass it back over to you, Joyce.
Thank you, Sandy. I think we're opening it up to questions now.
Yes, we will open it up. Thank you so much, Dr. Locke and Sandy. We will open questions starting with Kathleen Sailors, Sentinel Review.
Hi there, can you hear me all right?
Yes, we can.
Wonderful, thank you. My question is for Dr. Locke. With Ontario announcing that it would go ahead with second dose AstraZeneca shots for those who have already received their first dose, I was wondering if you had a local update on that and what residents should look forward to if that applies to them.
So those individuals who were part of the pilot studies with AstraZeneca back in March, so it was around March 10th to 19th, those are the ones now eligible for their second doses. The pilot sites were in specific areas, mostly Windsor, Toronto, and Peel. So anybody who drove to those locations to get their AstraZeneca shot during that week should return to those sites and work through those health units and their mass immunization clinics there to get their second doses. The ministry has directed the second AstraZeneca dose to those locations where the first dose was handed out.
Perfect. Thank you.
Any follow-up, Kathleen?
No, I don't think so today.
Thank you. Moving to Chris Abbott, the Tillsonburg News.
Hi, it's Chris. Question for Sandy. The 2 deaths that happened most recently, when did they occur? Is there an approximate age? Are they Oxford County residents?
So Chris, I can tell you that one of the deaths was just very recent. I believe it was this morning and not an Oxford County resident. The other 2 were earlier in the pandemic, and I don't have specific detail on those 2 individuals. I don't know if Dr. Locke does or if we can defer that answer until after the meeting today.
Okay, because I'm pretty sure on Friday there was only 1 reported.
No, we've had 2 for a little while, Chris. I can't remember the exact dates, but there have been 2, and just the recent 3rd death was this morning, reported this morning.
Okay,
We'll
thank
get
you.
back to Chris with the details.
Yep, thank you. That's all.
Thanks, Chris. Moving to Ian McCallum, MyFM.
Hello, Dr. Locke. Can you hear me all right?
You're a bit faint, Ian, but I can hear you.
Okay. Question with regards to the long-term care homes and retirement homes. Are they or have they completed the second shot for both residents and staff at those facilities?
They have not. We have a schedule. We are tracking when each facility and each individual received their first shot, and we're ensuring that the staff all get their shot at the correct interval. So for the staff, they had to wait the longer period, but for the residents, they were permitted a more rapid time frame for their second shot. So it's a process in progress to get them all done. These staff are frontline healthcare workers, and they were part of the cohort that were permitted to have an accelerated second dose. So they, along with other frontline healthcare workers, are getting their appointments rebooked to facilitate having that second shot done more expeditiously.
And I have a related follow-up question. With the increase in vaccine coming into the province and the amazingly streamlined process that everyone is doing here in the health unit, is there still a likelihood or possibility that some of the people waiting their second shots, that may be reduced from the 120-day period that we're using now?
So that is a possibility. The province is looking carefully at both the first dose strategy and the second dose strategy now. It is very important that everybody gets their first dose and that we don't inadvertently displace some individuals from appointments for their first dose due to those who may get their second dose earlier. So that is being looked at as we speak. I know that the ministry is very actively counting numbers and doing the calculations to define more clearly what we can do with our vaccine supply and the second dose interval. So I think the best thing to do is to stay tuned and know that that question is under active consideration.
Great, thank you.
Thanks, Ian. Moving to Chris McMillan, Heart FM.
Hi, Dr. Locke. Thanks for taking my questions again today. You're probably not surprised what I'm going to ask, but we're hearing word that there's going to be a decision on schools. It's imminent. There's talk of regional reopenings. What are your thoughts on that? And if it went regional, based on the numbers, and you tell me, but it would seem like our region would qualify for a reopening if they did go that route.
Yes, so good question. It is a decision that is made by Cabinet, and so as such, we do, like everybody else, need to wait and see what the decision is. I know that there are competing interests. There are benefits of children being back in school for sure. So from a health unit perspective, we would like to see our students back for in-person learning. However, there are only a few weeks remaining, and so there are logistical issues to deal with for a very short few weeks. There's also safety concerns that I know that are front of mind for many of the staff and parents of the students. We are starting to roll out vaccine in the 12 to 17-year-olds and our teachers, but we are far from completing all those groups. And I know that the ministry will be taking all of those issues under consideration and attempting to make the best decision. So we'll just have to wait and see what the decision is.
And my follow-up is for Sandy. Sandy, given the outbreak at Tillsonburg right now and not accepting patients other than urgent care, that really urgent type of stuff, has that put a strain on the other hospitals? I know you're also CAO in Ingersoll. I don't know if you can speak to other surrounding ones, Woodstock, but has that put a strain on other hospitals nearby? I guess Norfolk would be another one right near Tillsonburg too, would be the three kind of ones that might be impacted the most.
Yeah, that's right, Chris. So as of the weekend, we were able to open up 2 out of the 3 inpatient units. So we are starting to, we call it repatriate or move patients back home to the Tillsonburg community. But prior to that, you're correct, our admissions were primarily transferred to either Ingersoll or Woodstock Hospital. Both hospitals did have capacity at that time to accept those patients. We did have a backup plan that we would move patients down to Simcoe as well if we needed to, but we didn't need to push that button. At this point in time, though, I believe that the patients, as I said, are coming back and our capacity has stabilized at this time.
Thanks, Chris. Now we have Rob Perry from the Elmer Express.
Hi, my question is for Ms. Jansen. I just want to ask you what the vaccine uptake rate has been among your staff at Tillsonburg District Memorial Hospital in terms of a percentage, if possible.
Yeah, so as of last Wednesday, we were at 52.4% of staff vaccinated.
And could you also tell me, on a related subject, when you mentioned closing the 3 inpatient units, could you tell me how many beds would have been involved in those 3 units?
Yes, I can. So that would be about 40 beds that were closed.
Oh, beds. And were they all occupied at the time?
Let's see, they would have been occupied. We would have had about 92% of those beds would have been occupied at the start of this outbreak, between 92 and 95%. We did not, we kept obviously all of those patients who were active inpatients at that time stayed in the hospital. We didn't move them and continued to care for them, and a number of them have been discharged since then. So over that time period from May the 5th until the weekend, the occupancy just slowly declined because people were going home or to their long-term care home, but they weren't coming in at that point in time.
Thank you very much.
Thanks, Rob. And lastly, we have Shane Ketnis from Rogers.
I got nothing today. Thank you.
Thanks, Shane. So that completes our media brief for today. Again, I'd like to thank you, Sandy Jansen, for joining us today. And if there are any additional questions, please send to communications@swpublichealth.ca and we'll get back to you. Thank you so much for joining.